very established, very well known in Aberystwyth, and the fact that I don't go to him, it's got nothing to do with it. Sean has retired now, so and you had a practice in North Parade, and you've been here for a long time, and it's just up now. Yes. Okay, there we go. Over to you, Sean.
I'll just turn down the lights a bit.
Well, diolch yn fawr iawn am y gwahoddiad heno. Thank you very much for the invite tonight. I'm not sure I've been in dentistry from that height. I think there's a law against that, actually. It's fairly strict. But it's dentistry. I've always liked a little bit of history and what have you, and it certainly struck me that the dentistry of the past it can be quite fascinating. The earliest reference, like most things, is the Egyptians. And basically, they knew how to sort of treat soft tissue wounds. Well, they thought they did. They probably did it very well. One of the things that's itemised was that you would chew on fennel seeds. However, they thought that if you had a fracture of the jaws, mandible or maxilla, it just led to death. And probably it did, because in those days, care of such injuries, which could be quite nasty, was probably pretty primitive. There's a Petrie, there's the Edwin Smith papyrus, which was found, it dates back to about 1700 BC. It's in the Petrie Museum in University College London. And it talks about various techniques there, and it actually talks remarkably for the, talking 5,000 years ago. Fillings, they used to use fillings, use wood, gold, but possibly, and we don't know, they're post-mortem fillings. So maybe that was a way of sort of restoring the body to perhaps how they thought it should be. Apparently there's evidence as well, probably from the tombs, that actually cotton buds were around in 3000 BC. It's not exactly dentistry, but it's not Johnson & Johnson's only. It was devised before then. There's also a mandible. There's a couple of instances. There's one that was found 3 to 2,500 years BC, which showed evidence of extraction before death. And here we are on the top left corner. You can see. You can see a skull, but apparently with analysis there's evidence, and not just that these were actually lost through support of bone or anything like that, but it did look as if they had been removed and there'd been some healing and then death. The second skull actually is from a British peat bog. And what's interesting about this, it goes back. You see, we always think that overcrowding is a little bit of a feature of modern dentitions, that softer food, gradually there's been an evolution away from jaw size and massiveness and strength. But actually, as you can see, there's a malocclusion or overcrowding. You see the upper right lateral side incisor there, it's stepped in. It's quite a common thing these days, actually. It's probably the most common type of orthodontics that's treated. A bit of a leap now, and we go to about 1200, 700 BC, the Etruscans, and you're looking at dentistry here, which really was not achieved, well, basically even into sort of late Victorian times. You're looking at very fine gold work. They were known for their gold work. You're looking, there's evidence there at the top left, that's a bridge. There's also, it's getting the support from the adjacent teeth. That also is a bridge. They think that maybe some of these were actually designed to be removed, so they could be cleaned. Possibly the one on the right, in the middle there I should say, that would sort of clip over the other teeth. But anyway, it's very fine work by whatever standard you choose, and here's some more. These are similar features. The one on the bottom right is a cantilevered bridge off the canine, off the lower canine tooth, and as I say, this was not work seen to be done really until probably, as I say, the late Victorian times. This is a mandible called the Ford mandible, after the man who discovered it, and this is Phoenicians. This is a bit later, but again you can see the similar. They've actually, the teeth are intact here because there's still a certain amount of, well, very, very minimal support. They've obviously gone for splinting here rather than a bridge, but again, pretty clever work, but a different civilization. Now then, we come now to something like 300 BC, Aristotle. And anyway, he advised various things, that if you needed to have a tooth removed, you used your fingers and you used it did it very gently, softly, catchy monkey, so to speak. Sorry, the light's not good again. Can't read my notes. That might help actually. Yeah. There's also from this time evidence of a chap called Dr. Cornelius Celsus, and he had, as I say, this is Aristotle's idea. Mouthwash of pepper and castor oil was very beneficial. Dr. Cornelius Celsus, he talked about myrrh, saffron and figs, and this was a sort of a paste, and you actually applied it to the opposite shoulder to the toothache. And there's another example, not quite so nice, because dog's teeth boiled in urine, and you use that as a mouthwash. Anyway, he said that poor people, this is a quote presumably from the Greek, or is it Latin? I'm not sure. Anyway, poor people show rude health, and it's the idleness of civilization that causes dental decay. So possibly he wasn't far wrong. A little bit of a jump now to the Roman times, Pliny the Elder. He also had some very strange ideas. I'm not sure that he actually practiced dentistry, but he certainly wrote these things down. One of them was that if you had loose teeth, if you tied a frog to the jaws, and this apparently reduced mobility. I'm not quite sure how that worked, but anyway, something a little bit more gruesome. That if you wanted, this is a treatment for toothache. As I say, scratch the gums of the tooth of a man who had been violently killed. And you say, well, there were a few of those in Roman times. And another thing, which was probably more painful, was you pour into the air oil in which earthworms had been boiled. So.
And they used to burn witches, didn't they, in this country?
Sorry?
They used to burn witches in this country for just using herbs.
Right, yeah, well, all I can say is, I think if somebody poured that into my ear, I'd like to burn them alive as well. Anyway, we come now. Oh, there's a slide here that's jumped. I saw this the other day. I meant to change it, but I thought I might lose it. This is just of interest, actually. It's out of sync. But this is from the Iron Age, and it's a skull. And you've heard of dental implants. Well, they're basically titanium, and they work very well. Well, this actually is a piece of iron. And it has, the term is osseointegration, which is actually integrated into the bone. Well, this bit of iron that somebody stuck in, presumably the tooth, was lost either through periodontal disease, because you can see the bone support of the tooth next to it is not brilliant, or it was knocked out. But anyway, that piece of iron is solid. And a bit, there we are. Anyway, Roman times now, and he's got quite a few epigrams referring to artificial teeth, made of bone, ivory, and also wood. And one of them, he talks about Maxima, who has 3 teeth made of boxwood, which are as black as tar. But presumably she could eat with them, because there'd be no other reason to wear them, I presume. And another, he speaks of the Lady Gala. You lay aside your teeth each night as you would your silken dress. How they were kept in history doesn't tell us, I'm afraid. Now then, there's a bit of a gap then, because with the fall of the Roman Empire, there's not a lot of literature sort of into the Dark Ages. Dark because we don't know very much about them, not so much that the sun didn't shine or anything. But there's one story that's come down which is quite interesting. It has a dental component. It's not exactly dentistry. But there was a great rivalry between Mael, who was a 9th century Pictish nobleman, and a fellow called Earl Sigurd the Great, the Mighty, or whatever you want to say, and he was from Orkney. And anyway, they had a falling out. So they agreed to settle it on the battlefield. And they said, we will turn up with 40 men each. And Sigurd turned up with horses that had 2 riders on them. So in the distance, you couldn't see. But as they grew near, instead of 40, he turned up with 80. And indeed, he was victorious. And anyway, Mael was also called the Bucktooth, because presumably he had a teeth or tooth that stuck out somewhat. But anyway, on the battlefield, he fell to the sword. And legend has it that Sigurd took his head off and had it on his saddle as a trophy riding back. And whilst in the process of riding back, the bucktooth actually cut Sigurd's leg. The wound became infected and he died. Revenge post-mortem. That's a story that's come down from somewhere. How and why, I'm not completely certain, but I didn't make it up. Now then, into Persia now, and the 9th century. This fellow talked about fillings in live people rather than dressing up. Perhaps, we don't know for the Egyptians whether it was done to decorate the dead or not, but certainly he did it on live people, of alum and mastic. This really is the first time since that sort of end of the period of the Romans that anything about dentistry was recorded. And as I say, he described this type of fillings. Slight leap forward now, we come to Abul Qasis from Arabia, and he recommended scaling. He discussed techniques of extraction and also splinting using wires. And there's no evidence, there's no physical evidence that dates to this period that I'm aware of has been found. Whether it was as good as the Etruscans and the Phoenicians, I don't know. But it was certainly, he did talk about it, and there's the picture there. Well, I think that's meant to be a dental mirror. It's doesn't look like anything else that I can think. Doesn't seem to have any forceps attached to it, so perhaps he was just having a look. But as I say, he's quite formally documented in these scripts. He also has some. There's some dental instruments there that are pictured. We'll see a bit later. These are echoed a little bit in the later sort of dental type of world. Now then, a bit of a leap forward, but it did start actually in 1308, namely the Guild of Barber Surgeons. And if you wanted dental treatment, it would be an extraction. And anyway, they were noted for their barbarity, I think. Tooth drawers, as they were called, were frequently itinerant. They used to have a lot of loud music playing, so people wouldn't hear patients being treated. And the saying comes from there, to lie like a tooth drawer. Happily, I don't think it's actually on everybody's lips these days, but it could be. But anyway, there's some examples here of instruments, and these echo a little bit of the ones that you had with Abul Qasis. You have the pelican, and you have, basically it's a claw. It's a serrated, it's got a fulcrum, the claw, and frequently, it's the key, let's call the key, and the other one is called the pelican with the joint in the middle. But the idea the tooth was removed by leverage, not necessarily against anything except another tooth. And to lose one tooth, you frequently ended up losing more than one tooth, I'm afraid. We then go to this. The Guild was disbanded in 1745, by the way, so it was around for quite a while. Now then, we have an Italian, but he was of Arabic origin, and he was the first person to talk about using gold leaf to restore teeth. And of course, gold leaf, cohesive gold as it's called, is like a sponge, and it would be actually applied, once the tooth cavity had been cleaned, it would be actually applied directly into the cavity, and they could be very successful. But he was the first person that's documented of talking about gold leaf for restoring teeth. In this sort of period as well, we come to the time of Elizabeth, and skipped a little bit there perhaps, anyway I can talk about that, but basically Elizabeth, in December 1578, she was having awful toothache. She'd lost nights of sleep, and she had to be persuaded to have a tooth removed. And the Bishop of London, it is said, to show her that there was nothing to it, sacrificed, although he didn't have many teeth left himself, he sacrificed one of his teeth to show her ladyship that there was nothing to fear. She was noted actually in later life for padding out her face, so certainly her mouth, to restore that sort of those features that lost because she'd lost teeth, and obviously with age and what have you. In this sort of period, there was a Swedish mad king as well, Gustavus, and he was known for rather strange antics. Reminds us of a certain premier of the present day, possibly. But in his case, when he died, and they had a good look at him, they discovered that he had an awful lot of dental abscesses, and his mouth was in a pretty disgusting state. And well, looking back, it was probably thought that he was pretty delirious with fever at various times when he was perhaps not behaving properly. Samuel Pepys, now he references dentistry sometimes, and this is a period when nitric acid was used to whiten teeth. You can do that a few times, but actually it whitens teeth because you dissolve the enamel away, so it starts to get a bit sensitive after that. This is a period actually where France and Germany were far more advanced in their dental techniques than Britain was. And if you look at this, Pepys talks about a Peter de la Roche, who was French, and he's reckoned to be the first specialist, so to speak, who knew a little bit more than virtually nothing about dentistry, and he styled himself the London operator for the teeth. But anyway, we move on a little bit. In this sort of period, we find quite weird and wonderful systems. Teeth basically carved from hippopotamus or walrus ivory rather than elephant ivory. I'm not quite sure whether that was found better. The first recorded partial dentures were by a fellow called Heist of Germany in 1718. Those were the first recorded. And basically their shape broadly sort of kept them in place. I think you find that people probably use musculature for them to actually keep there, and they train themselves to keep them because they probably were not very effective for eating. They're probably more for show. You see one at the bottom that's got a sort of spring on it. Well, we'll come to a chap later who's a little bit better at that sort of thing. Then Edmund Burke now. He's well known, he was a philosopher, he was a big friend of Samuel Pepys. And the British Dental Association's got a bit of a museum, and his false teeth are there. And what's interesting, he had a cleft palate. You can see this works as an obturator. An obturator closes off the cleft in the palate so that speech is a little bit more distinct. and these days an op, not necessarily very much an op, but orthodontic treatment and then an op on even very young babies tends to close cleft palates very effectively and split lips as well. Edmund Burke, of course, is saying is all that is needed for the triumph of evil is for good men to do nothing. We're jumping continents now. A fellow called Tiradentes, which actually means tooth puller, and he was the first and, well, reckoned to be the greatest leader of the Brazilian independence movement. He was hung for his troubles, and actually on his birthday, rather than possibly Independence Day as well, but his birthday is celebrated actually as a public holiday. And for dentists in Brazil to call themselves Tiradentes, which is a little bit slaggy, is actually in Brazil an honour. There we are. That's right, yeah. Tiradentes popularis, presos popularis. I think that was, in 1889 this date was made a bank holiday, that's right. And he was held in great high esteem.
Can I ask why was he executed?
Well, he was against the Portuguese government. He was the leader of the initial independent movement, yes.
Okay, thanks.
We have, well, not quite the same, but there are actually local to Aberystwyth, a chap called Nicholas Gleis. He had a practice in Elmtree Avenue, and he was actually the founder of the Welsh Labour Party, well, the Labour Party in Wales, but he was actually one of the founder members of the Communist Party in Britain. And he was a minister, a chapel minister, and he was kicked out because he preached communism, basically. But his wife was a dentist, and because he had been working for a period sort of before the First World War and afterwards, in 1922 the Dental Act came in, where you had to have been either qualified, that you'd done a course, or that you had worked as an apprentice for 6 years, or you could no longer work. Well, he went in on that act because his wife was a qualified dentist, and he'd been working there for, I think, 10 years before 21. But he was quite a character, and there's still many stories about him, actually. When I first came to Aberystwyth, I was talking to a gentleman, his father was with him, and he said that as a young man, this chap was 80 and about, well, he's in his 80s, in the 70s, late 70s, and he said that he was walking by Rhydypenna there as a young man, and he had awful toothache, and as he went past in his car, he'd been working in Machynlleth, was Nicholas Gleis, and so he flagged him down, and there at the side of the road, he took the tooth out. Well, in those days, the local anaesthetic didn't exist, it was gas or nothing, and anyway, he said, how much do I owe you? He said, my boy, he said, you've paid enough in suffering. Jumped into his car and off he went. So, not quite Tiradentes Brazil, but quite our own little homegrown character. There we are. Now then, in 1770, we come to the time of Thomas Beardmore, and he produced what was then, it was the only one, it was certainly the first one in Britain, a textbook on dentistry. And it was in print from 1768 to 1844, 76 years. And that's some sort of record. I think very few books are actually in production for that time. I'm not quite sure. His plaque there near this place lies interred the body of Thomas Beardmore, who acquired a liberal and ample fortune by the profession of dentist. He died 7th of November 1785, aged 45 years. Anyway, now then, in this sort of period, we come to a time where you ordered teeth by post. It's a bit vague. They used a compass to measure the jaws. I'm not quite sure, and I don't think it's known whether there was some sort of diagram that was given for people to measure, but it was all pretty hit and miss, I think. What is interesting here, there's a my parents moved to Newport, Pembrokeshire, and in the top of the house was an old oak chest, which I've got in the lounge now, and it's full of old court papers, as the house used to be a well, it was the vicarage, but it also served as the magistrates' court. And there were a lot of papers going back 1700s into the 1800s, early 1800s. And I've kept three. I had three of them framed, but my father took the rest down to the archive. And they were court orders for maintenance of legitimate children and the like, and people going on the parish. And the signature of one of these magistrates was called Bateman. And there was a paper in the British Dental Journal a good few years ago now, and they talked about people having their dentures adjusted by post, and it was looking at the letters that had gone backwards and forwards. And there were several letters there from this chap, Bateman, rector of Newport, Pembrokeshire. So I sort of came across him from two completely different angles, but this is the sort of period where, you ordered them by post, you had a compass to measure the jaws, and presumably if you needed them adjusted, you sent them back. So thank goodness that things have improved a little. Now then, in this, there's another sort of nasty bit of business, transplants. And people, believe it or not, would have loose teeth, and they would pay poor people for their teeth. So poor people would go and have teeth extracted and then stuck in the hole. History doesn't tell us how well they lasted, presumably not very well. But it was very tempting because you're looking at 2 guineas a tooth. So that was a lot of money in those days. And in fact, Lady Hamilton, sorry, she wasn't lady then, Emma Hart, was it? Anyway, Nelson's lady friend. She was actually on her way, because she was destitute, she was on her way to have some teeth removed in order to have them transplanted. And somebody on the way persuaded her not to. And of course, that was probably very good advice. There was a chap, he was in America, obviously, but he was a Frenchman, Pierre Monsieur. He treated George Washington, but there's no evidence that George Washington had any teeth transplanted. But his aide, Colonel Varick, had 4 incisors and a canine transplanted. So they saw nothing wrong in the ethics of that. In that sort of period, 1776, this isn't quite about transplants, but it's interesting because I think it's the first bit of forensic dentistry that we know about, is at the Battle of Bunker Hill, Paul Revere, who was a silversmith, identified General Joseph Warren by his upper partial denture that Paul Revere had, been involved in its construction and had adjusted. I think that's the first time. You hear of people very often being identified by their dental records, but I think that's the first reference we have of anybody being identified like that. Now then, Pierre Fouchard, he actually was the father of modern dentistry, both in terms of techniques, attitudes. What's interesting is somebody like this would run alongside this whole business of transplantation and other business, but he is reckoned to be the father of modern dentistry. He thought that having dentures was better than to tolerate spaces. One technique in those days was to have your gums pierced with a ring, and you would secure some sort of prosthesis with silk thread, tied in, and probably not remove it until the silk all rotted and came out again. So hygiene was not of the greatest importance. Anyway, he thought this was a disgrace, and he used to make dentures using impressions, wax mostly, almost certainly just wax, although you can do it with plaster of Paris. And anyway, he also devised, because perhaps the retention of the denture that was made, again you're talking about carved ivory, would be held in place. You can see in the middle of the picture there, springs. And he did in fact make some quite elaborate structures that I haven't seen any in the flesh, I've seen pictures of them. But the bottom one, you can see it actually sits across 2 existing teeth, so it gets support there, and the actual pressure of the spring works like that. I have actually seen people, not since, well, the 70s when I qualified, and old dentures that were that did actually have a spring at back to aid retention where they'd had, but you're talking about dentures that were probably 60 years old and were probably pre-First World War. Dentistry's always attracted somewhat eccentric people, and I think this character is no exception. They reckon that he was probably one of the first salesmen. He used to ride around on a white pony, and it was painted with stripes and spots, and he kept the embalmed body of his first wife in the waiting room. Why that was an attraction, I can't imagine. Anyway, 1790, the first porcelain teeth were devised. This is in turn not crowns now, because it's a technique for preparing teeth and what have you. This is for use in dentures as opposed to ivory. The problem with ivory, of course, in mouths that aren't kept, is that they would decay, they would discolour, they would smell, they would harbour bacteria, and they'd be generally very unhealthy. At least with porcelain, it's a lot easier to keep them clean, and they maintain their cleanliness. Jenner, the inventor of vaccination, actually wrote a commendation for Duchâteau. He was a French apothecary, and he is credited with inventing the first porcelain tooth. Interestingly, one of the people selling ivory teeth in those days, in about the sort of 1790s we're talking about, or even before that, was a chap called Claudius Ashe. And the firm he founded, I can't say now because I haven't actually ordered from them for a few years, but they were still going strong in 2010 anyway, as dental wholesalers, basically, the people that's where you would get your stuff from. But ivory blocks for carving were sold actually as late as 1875, which is a little bit surprising. In the 1800s, the Company of Surgeons was established by Royal Charter, and then in 1843 the Royal College of Surgeons was established, and dentistry, by nature of what it does, fell into that particular camp. Interestingly, the people wonder why people who've done their fellowship in surgery, consultants or what have you, are called Mr. rather than Doctor. Well, they're Doctor until they've done their fellowship, and then they become Mr. And this is a sort of inverted snobbery, because the physicians were first given the right to call themselves Doctor about the time when because the physicians, they were established before the 1800. And the surgeons, the barber surgeons, the bloodletters, they were considered to be beneath them. And so the physicians used to sort of look down their nose at them. Well, when it was accredited that the Company of Surgeons was established and the Royal College of Surgeons was established, the physicians then said, well, you can join us now. So the surgeons said, no, we won't. And that really is the origin of how this Mr. and Doctor sort of thing has come about. Now then, 1818, first reference properly to dental floss as opposed to silk thread and its use. It was bridges and retainers were constructed. These would be, again, sometimes held in place by silk thread. Probably that much more available in those days, so they would be more commonly removed for cleaning, perhaps not on twice daily basis, but at least more often than waiting for the actual silk to rot away. But a lot of these retainers, these bridges and things, were probably not as healthy. You can see on the lower right there a couple of teeth and some sort of plate to go behind, and then of course they're tied into place. Not as effective as Fauchard's partial dentures. Now then, I think we owe a debt of gratitude to this gentleman. Horace Wellesley was a dentist in Connecticut, and he went to a demonstration because they discovered that nitrous oxide was good fun, and they used to give demonstrations, getting people half drunk on it, and then they'd wander around and misbehave and all sorts. And Horace Wells went to a demonstration, and there's a gentleman there who, in lashing around, cut his leg badly, and he wasn't aware he'd cut it, and he wasn't in pain with it. So Horace Wells then decided, well, this might be useful in dentistry. And he is accredited as being the first person to introduce anaesthetic for any operation, because at this stage it wasn't used for surgery. Surgery was you tie them down, you get them drunk, and you just act quick. I think the record for somebody having a leg amputated was something like 10 seconds, and he took 3 of his assistants' fingers off as well, just to give a sort of example. But anyway, Horace Wells, I think the world of surgery owes a debt of gratitude to this particular dentist. Unfortunately, he did become addicted, but the first extraction was his own. He got a friend called Rigg, surname, that's his surname, who was also a dentist in Hartford, Connecticut, to anaesthetise Wells. I think Wells sort of anaesthetised himself as well, but he took a tooth out. And he did it several times, and then he demonstrated in Boston, and it didn't actually go terribly well, and there was a little bit of, he was discredited to a certain extent, but he stuck at it, and then of course the rest is history. But he could have patented the idea, and he said no. He said, let it be as free as the air. So I think we do owe him a debt of gratitude. Now then, in 1850, the technique of vulcanization of rubber was invented. And who invented it? Well, none other, nice Mr. Goodyear. And why is that important? Well, dentures, until the advent of acrylic, which was actually not long before the Second World War, was the material of choice for denture-based material. Full dentures, partial dentures with porcelain teeth. And, well, as I say, I've seen many vulcanite dentures. I've seen 1 or 2, as I said, with springs. They predated again. But vulcanite was in use between the wars. And in fact, probably, although I can't be certain, probably after the Second World War in 1 or 2 places, possibly. But certainly in the 70s, you would see. Not often, but not rare. Uncommon, but not rare, put it that way. Now then, as I said, something about dentistry which can be a bit macabre. Now, the 1800s, they came across the idea of Waterloo teeth. This is despite the fact that porcelain teeth had been invented. Now, Waterloo teeth, as the name suggests, were battlefield teeth. And people would go around the battlefields and take teeth from corpses. They also, you've heard about these resurrectionists who were grave robbers. Well, that actually, not just sort of a gold watch or something, or gold rings that were buried with the unfortunate, but their teeth. And it's documented that grave robbers would sometimes come away with 40 teeth in a night, having pilfered a graveyard. And this actually is how they were, those but basically are ivory bases, and the Waterloo teeth have been set in to the base. And this is how they presented. As a point, the last barrel, because I think they were shipped in barrels of Waterloo teeth, actually came to Britain in 1872 as a result of the American Civil War. It's quite startling because my grandfather was born in 1878. Well, one of my grandfathers was born in 1878, so you know it's 2 lifetimes ago. It's not that long, and But then again, although it's slightly different, up until the 60s, of course, human hair was used for wigs. Hair grows again, of course. Anyway, 1870, we've actually now got a porcelain crown where they had the techniques in terms of drills, etc. A certain amount of anaesthesia with nitrous oxide to create porcelain crowns. In 1902, actually, let me just go on a little bit. We've got there Roosevelt, when he had one fitted in 1902, and he went out and he noted that he received 6 proposals of marriage. A bit of an exaggeration, I think. But sometimes the means of crowning a tooth was not good, where if the root was retained, they used to restore the tooth, the crown, and they would use sticks of hickory into the root canal, and as these became moist, of course, they'd swell, and that would retain the crown. For how long, I don't know. But certainly in 1911, just before the First World War, there was an awfully big row, and I quote, "Mausoleums of gold were a sea of sepsis," which was true because the techniques of root filling and things like that were pretty primitive, if not non-existent. So that's just First World War, 100 years ago. Now then, jumping back a little bit, but Sir John Tomes, he was, if you like, a later day Fauchard. He was an anatomist. He was the first name on the first register of dentists in 1878 in Britain, this is. And he established the British Dental Association. He was a dentist, but he was very interested in anatomy, and this is an example of his dissection of, well, let's say, child, I would say, probably about 10 years of age, possibly 11. And he wrote various textbooks. He was knighted in 1886, and in 1878, as I say, the register was established. You could still practice as a dentist, even though you weren't on the register, but you couldn't use the title. In those days, you had to be apprenticed. It was 5 years, and it would cost you about £300 to £500 to be indentured. I've got some examples here of some Victorian type mechanisms. What you have there on the left is a clockwork drill, so it actually got wound up and then drilled away. On the right is a means of filing a tooth down. And then, I don't know if any of you had experienced a rubber dam, but they're still in use, certainly for root treatments. That was invented in 1900. It's a way of isolating a tooth from the mouth so you can keep it dry, and if you use something that you don't particularly want the soft tissue to come into contact with, it also isolates the mouth from anything that might be used there. And this is an example of general anaesthesia, 1875. Nice old-fashioned chair there. The idea with there's a technique using nitrous oxide now called relative analgesia, RA, as opposed to GA, where you use it but not very deeply. So it gives you analgesia, it kills pain, and you're a little bit so-so, but you're not actually anaesthetized. And probably most of the GA, so-called in this time, were RAs, because techniques of resuscitation and things like that were not good, and probably the skilled anaesthetist would make certain that the person was kept sufficiently light that they weren't going to expire. very bad for trade if you're a dentist, killing people off. There's an example now of a poster from this period. Advertising artificial painless extraction by gas, 5 shillings. There's some other prices there. Yeah, vulcanite at 5 shillings, and as I say, it's what you could get for 5 bob in those days, eh? Anyway, John Tome started the idea of dissection for people to learn a lot more about their anatomy that they were dealing with, and as I say, this is some nice. These are actually Victorian in the BDA museum. These are Victorian, and it shows a lot of care. But of course, as a means of learning and demonstration, second to none. There's another example here of a Victorian. I think this is a lamp, and you had a candle and a system of magnifying the light so that it concentrated it. I think this is quite an early one, because later ones would presumably have used an oil lamp, which would have given you that much better light. There we are. And anyway, I'll just go on. It's not as long as what I've just been speaking now. This is a nice example of, you see, there's an irony about teeth, is that they're the first part of your body to let you down and rot away, and yet when the day is done and the deed is over, they last forever. And one of the classic cases of sort of the use of dental or dentistry, if you like, in terms of looking into history, was done by this lady in 2006. And it refers to the plague of Athens. And it was always, there was a lot of this historian, Thucydides, I'm not sure how you'd say that, chronicled the mass demise of many people. And from the symptoms, it was always a bit difficult to tell what it was. Well, actually, the teeth they came across a burial pit, and from teeth, the pulp, nerve of the tooth, if you like, the teeth were sectioned, and the pulp was analysed, and in fact there were bacteria there, which showed what the plague of Athens actually was. That was typhoid, and by looking at the teeth, you could see what was the cause. Are we for time? Okay. Just five minutes. I'll just go on to a couple of other little things. There's an interesting thing you might be interested in, allometry. There was a study done of skulls. It isn't exactly dentistry, but it comes from it because of sort of angles that he used in the mouth and what have you. And from burial pits from the 14th, the Black Death, 16th was Mary Rose, and modern day skulls. There was some work was done in 2006 by these 3 people. There were 30 Black Death skulls, and that's 676 years ago. 54 Mary Rose skulls, and that was 459 years ago. And the skulls there are actually, you can see, there's quite a difference, because the skull on the left is lower in the front, and the actual volume, the next one, you can see the actual volume of the one on the right, the later skull, is that little bit more. And just by going on and looking at angles, you can work out volumes. And if you look at these, I'll just go through them quickly because I'm not going to test you at the end of it. And basically, by a combination here, you get a figure which gives you the volume of your frontal lobe. And frontal lobe is, of course, what makes you different to a chimpanzee or whatever. There might be a frontal lobe there, but in humans it is what basically is creative and self-awareness and what have you. And it's in a short period of time, well, difference between primates and humans. Modern faces have become a lot less pronathic, as we've got big jaws out here, desperate Dan, so to speak. The volume of the cranial vault has increased, the length of the vault has increased, and anyway, this sort of goes, you see different spikes in life, and yeah, I won't go any further than that, but it shows actually an increase in volume between now and the Black Death of about approaching 20%, which is quite significant when you consider that it's, how many generations ago? It wasn't that many. Sorry, I thought I had a figure here.
You did. You did.
Pardon?
It was on the slide. The number of generations.
Oh yes, that's right. Yeah, no,
Yeah.
I thought I had for. Oh yeah, so I did have the percentage here. That so I'll start with these angles again because I did have the percentage there. There we are. That's right. That's down 3% as time has gone on. That's gone up 5%. That's gone up 10%, and that's 16.2% is the increase since the Mary Rose, which was 33 generations ago.
13.
So anyway,
Yes.
I've got a bit more, but that's a different thing. That's to talk about what's made the big
There's
difference.
200 years.
I'm sorry?
200 years. In 200 years.
Yeah.
All that cranial stuff, 16% in 200 years.
No, it's not 200. It's well, Black Death was in the 14th century, 1348. So 1348, 1948 is 600 years.
Still not that long ago.
600 years. So 600 and
Yes,
well,
but
this
the
way.
Mary
Yeah,
Rose.
it's well, call it
1540. Yeah. So. Okay.
so it's
Yeah,
16.
500. Anyway, it's a lot. It's a lot of percentage for relatively.
Well, that's
Yeah.
that's
Yeah.
a millisecond in terms of sort of
Yes.
evolutionary time.
Yeah.
What's the cause of that? Well, probably better food and also more stimulation as well, because I think that it's been shown that children who aren't stimulated are not quite as quick on the draw as children who have a very much more stimulating time. Basically, that's it. Yes, certainly.
Has Homo erectus,
Yeah.
did he have as many teeth as we do today, or did he have less? They seem to have a lot of teeth.
Well, we'll go
Is it
forward
the
a bit
same
because I've got a
number?
picture. No, basically the same number of teeth. You're talking 32. Yes.
Oh, that's what I wanted.
Yeah, 32.
Are you taking questions, Sean?
Sorry?
Are you taking questions? Are you?
Oh yeah, no, I love questions. Sorry, there's a picture of, here we are, the next slide. Now if you look there, you will see, if you count them, I think you will find there's 2 premolars, there's 3 molars, 32 teeth. Nobody's ever asked me that before, actually. I just think of my feet a bit.
So I have a question.
I haven't treated many Australopithecines. Yes.
I've got a question for you. Do you have all your own teeth?
That's very personal.
Well, actually, I lost 4 as a child to make space, and I had gas. A chap called Percy Evans. He was a school dentist in. Do you know Percy Evans? No, sorry, not even. Maybe I was wondering if you ever knew Percy Evans. You knew Percy Evans. His son, actually, Anthony, was the headmaster in Llanafan until recently. Percy was a lovely man.
So you have all your own teeth
And
apart from
you-
those 4 which were taken
Apart from
out?
those 4, yes.
Excellent.
Yeah.
Very, very good. And
Yeah.
would you put that down to your own good dentistry and care of your
Well,
teeth?
I didn't treat myself.
Yes, but presumably you're
Well, you
aware
look
that-
after yourself. I mean, I'm lucky. But the thing is that you can be unlucky because the thing is your teeth. Okay, you do the obvious things, but teeth do vary in strength and all sorts. Important is the saliva, the sort of minerals in the saliva, the diet, obviously the acidics and things like that. So you do get people who look after their teeth, but they have a big problem perhaps with periodontal disease. So they lose it from that point of view. But if they do everything correctly, look after their teeth, well, hopefully that can be, modified.
Well,
But to go
yes.
back to Percy, I had gas. And I can remember it, and talking about RA, when you're sort of relatively there, because I had a dream. I was under gas and I was falling down a bottomless pit, and I was hanging on to Percy's thumb. And as I was falling, this thing was just continuously stretching. And as it was stretching, it was making the most horrendous noise. Well, you all know what was going on there. He had his
Yes.
thumb into my mouth, and of course the sound of the teeth being taken out.
Yeah.
But so I've experienced RA as such
Oh.
from that point of view, and I can say I didn't feel a thing. And obviously, because with RA you're very light, it's much safer as well. So it's not necessarily something to be worried about.
Yeah.
Question. Is it true